My name is Dr. Priya Treesa Thomas, and I work in National Institute of Mental Health and Neurosciences from Bangalore, India. We are an Apex neuropsychiatric hospital catering services for neurology, psychiatry, and neurosurgical conditions in South India. We have a system wherein, as a clinician, we see patients who require care. We also train people, healthcare professionals, and we also do research. So, it's three mandates are there. So, we are clinician, practitioner, teachers, basically. So, also any research, unless and until care is built into it, it will not sustain, it will not scale. So, we have a unique system in this, in our institute at least. We have to do patient care, and in that, research is built. So, all my research has been patient practice based, patient centered, or person centered, so to speak. But also, it has to kind of build evidence. So, it is, we believe that the team that I work with also, we believe that um, patient care has to go along with the research. And that is what is happening in our place. And I think that that makes sense. So, one of our mandates have been to ensure that people who are reaching out to us with severe illnesses mm, are started on long term care. Care coordination happens at different levels. As you might be aware, there is so much of diversity in India. The healthcare system in India is a combination of private and public systems, uh, and the levels of public healthcare system happens at the primary, secondary, and tertiary care levels. So very often, diagnosis and multidisciplinary care are started at the tertiary care centers. So people have a long pathway to reach to tertiary care centers, and equally difficult pathways and barriers to reach back to long-term care support systems. So the way forward that we are trying to do is also to make sure people who get into the system and who receive a diagnosis um, are are supported through this process by effective communication from the time they receive the diagnosis, and access to resources at the local levels, and making sure that people are able to access. So it's not just about having available resources, it's also about affordability and being able to access. Large amount of proportion of our people are living in agrarian communities, rural backgrounds. So for them, and the healthcare services are predominantly focused on urban areas. So for people to have any long-term care, it has to be at their doorsteps. And that is why we are trying to connect with local healthcare facilities in terms of primary healthcare systems, so that there can be community level nurses and other healthcare workers who can do home visits and make sure they receive the multidisciplinary care possible. So, especially for long term neurological conditions and frail elderly who are developing multiple comorbid conditions that require long term care, these kind of support systems are very essential. Yes, so Indian community has always been collectivistic in the sense that family caregiving is the norm, and there has been very limited institutional support. We don't have long term stay homes, care homes. Of late, with migration and with the demographic transitions that are happening, there are more and more nuclear families which have only elderly parents living, and children are migrated to another places for work. That kind of scenarios, changing scenarios, are necessitating that there are more institutional policy level changes. So, but at the same time, given the large demand and limited resources the country has, the way forward is also to support families to provide care. So, as I mentioned earlier, the policies and institutional level changes or administrative policy, health policy level changes are to ensure that families receive allowances, families are able to access care at the primary care level, and to build capacity at the primary care level so that people with complex healthcare needs also can get support at that level. So policies are in place, and there are more and more policies coming up, schemes coming up, which ensures that people above, just recently there was a government level policy that was made, people above 70 years will receive free healthcare, which is yet to be implemented. But then these are all promising policy level changes, that there is a lot more recognition now that there has to be policy level changes for long term care, and we need to support the families to provide the care. So that's what we are trying to work at. The challenges are again diverse in the sense that at different levels, capacity building has to happen. Policies are there, but then to implement the barriers happen at different levels again. So, with the best policies, also, if they are not going down the grassroots level, that is not going to be helpful. I think those implementation barriers are the challenges in terms of different levels to build capacity, in terms of making sure all those who require. So the denominator is very high, and the proportion of people who are able to access whatever available services also are limited. And I think that universal coverage is one of the major challenges that our country faces, which again, by strengthening different levels of healthcare system and making sure people are aware that there are schemes and policies, more awareness drives are happening. Um, and also the so very often it's a matter of prioritizing for the families, in the sense that care requires that an able caregiver stays back home and take care of those who are requiring care. So to make sure that employment and income generation, all those are supported through probably. So we have caregiver allowances that are being proposed so that people can actually take care also without having so much of loss of income. So all those are some of the so finding a way to overcome these barriers are some of the challenges that we'll be facing going forward.